Well, good day to everyone joining us and welcome to today's X Talks webinar. Today's talk is entitled The Mind-Bending Mushroom, Expanding Consciousness and Cultural Acceptance of Psychedelic Alkaloids as Medicinal Tools. My name is Ryan Muse and I'll be your X Talks host for today. Today's webinar will run for approximately 60 minutes, and this presentation includes a Q&A session with our speaker. Now, the webinar is designed to be interactive, and webinars work best when you're involved. So please feel free to submit your questions and comments for our speaker throughout the presentation using the questions chat box, and we'll try to attend to your questions during the Q&A session. This chat box is located in the control panel, which is on the right-hand side of your screen. And if you require any assistance along the way, you can contact me at any time by sending a message using the same chat panel. At this time, know that all participants are in listen-only mode, and please note that the event will be recorded and made available for streaming on xtalks.com. At this point, I'd like to thank Cayman Chemical, who developed the content for this presentation. Headquartered in Ann Arbor, Michigan, Cayman Chemical supplies scientists worldwide with the resources necessary for advancing human and animal health. They manufacture high-quality biochemicals, assay kits, antibodies, and recombinant proteins and other contract services for custom chemical synthesis and analysis, bioanalysis, assay development, and drug discovery. Now I'd like to introduce our speaker for today's event. Danielle St. Germaine is a synthetic organic chemist in the Forensic Chemistry Division at Cayman Chemical. She earned her undergraduate degree in biochemistry and toxicology, as well as her MS degree in organic chemistry at Eastern Michigan University. While at Cayman Chemical, she worked in both the medicinal chemistry and forensic chemistry departments. Danielle's current area of focus is emerging designer drug trends and the synthesis of psychotropic reference standards. But now, without further ado, I'd like to go ahead and hand the mic over to our speaker for today, Danielle St. Germaine. You may begin when you're ready.
Thank you for that kind introduction, Ryan. Hello, everyone, and welcome to The Mind-Bending Mushroom, Expanding Consciousness and Cultural Acceptance of Psychedelic Alkaloids as Medicinal Tools. As Ryan mentioned, I'm an organic chemist here at Cayman in the Forensic Chemistry Department. I also wanted to mention that we are accredited under ISO 17034 and 17025, and we provide reference standards and certified reference materials for forensic toxicology and cannabis testing. We're also industry leaders in lipid biochemistry, endocannabinoid chemistry, and novel psychoactive substances. We also provide contract services including psychedelic GMP API manufacturing. My current area of focus is the synthesis of psychedelics that are found in natural sources, and many of them are derived from psychoactive mushrooms. And my work with these compounds inspired me to learn more about them and their place in history and society. So I'm pretty excited to be able to have the opportunity to share with you what I've learned. And today we will be covering a brief history, the chemistry, and the pharmacology behind some of the most notorious alkaloids in human history. After years of shame and stigma, psychedelics are entering a scientific renaissance, and there's a large body of research building around the active alkaloids found in nature. There are many flora and fauna that contain psychedelics, such as mescaline in peyote cactus, DMT in ayahuasca, 5-methoxy-DMT in Sonoran desert toads. There are many all over. A lot of understanding of psychedelics in particular come from researching active compounds that are found in the fungi kingdom. These fungi have been used in medicinal and spiritual practices by indigenous cultures around the world for as long as we've been around. Alkaloids from the species of Amanita, Claviceps, and Psilocybe are some of the most well-studied psychedelics, and yet there's still so much to learn about their role in medicine, mental, and behavioral health. And we'll begin with the gorgeous diva, Amanita muscaria. You can't tear your eyes off it, that beautiful red mushroom in the corner. The beauty of Amanita muscaria is likely the reason that it is the face of mushrooms in pop culture. It's renowned for its vibrant red cap and white spots. Some subspecies have colors varying from red to orange to yellow. The closely related species Amanita pantherina is more muted, with colors ranging from light tan to a dark brown. Images of these mushrooms are featured in many fairy tale illustrations, and it's the symbol of health in the Super Mario Bros. Video game, as well as provides shelter to the Smurfs in the 1980s cartoon of the same name. Its common name is fly agaric and is named so because of folklore that states it can be used to attract and kill flies. Amanita muscaria and Amanita pantherina contain the alkaloids mucimol and ibotenic acid, which contain an isoxazole scaffold, which we'll discuss in detail a little bit later. It hails from the Basidiomycota division of the fungi kingdom, and these are typically mushrooms that break down and digest organic matter. They are typically found in northern temperate deciduous and coniferous forests. Careful identification of fungi is imperative, and while some may be medicinal, others can be deadly. There are many species of Amanita that don't necessarily look like Muscaria or Pantherina, but they do grow in close proximity, and they are so poisonous that they've earned names like Deathcap and Destroying Angel. These species include Amanita phalloides and Bisporigera, which are responsible for the majority of the world's fatal mushroom poisonings. Earlier this year, an Australian woman served her husband's family beef Wellington prepared with wild mushrooms she'd foraged. 3 of the 5 family members of the luncheon died after it was discovered the dish was prepared with Amanita phalloides. The case into whether the poisoning was intentional is still underway, and just this past week, she was officially charged with 5 counts of attempted murder. Unlike Amanita muscaria and Pantherina, these species contain significant amounts of deadly cyclopeptide toxins, the amatoxins, phallotoxins, and virotoxins. The amatoxins are found primarily in the cap of the mushroom and are thermostable, and that means that the toxins won't decompose when the mushroom is frozen or cooked, making them especially dangerous. And they're also water soluble, which makes it very easy to absorb them. A fatal dose of amatoxins is around 6 milligrams, and it causes intestinal distress to begin with, and after a few days, acute liver damage eventually leads to organ failure and death. There is no currently well-distributed or well-known antidote to all of these toxins. However, just this past year, a research group found that indocyanin green can act as an alpha amatoxin inhibitor if it is given quickly after ingestion. Amanita muscaria has a few toxins of its own, but is not quite as dangerous, and these toxins hold a special place in medical history and our understanding of chemoreceptors. Amanita muscaria does have a rich history as a psychedelic. Multiple records of its consumption for shamanic purposes have been recorded in western Siberia between the years 1650 and 1750. The mushroom also makes Alice Change Size in Lewis Carroll's Alice in Wonderland, and it's often portrayed as the Amanita, likely for its psychedelic properties as well as its beauty. Lewis Carroll published Alice in Wonderland in 1865. Amanita muscaria also contains a very small amount of muscarine, in addition to its isoxazole alkaloids. The first monogram describing muscarine extracted from Amanita muscaria was published in 1869 by the pharmacologist O. Schmiedeberg and R. Klopp. The peculiar properties of this alkaloid would eventually initiate the search for the chemoreceptor acetylcholine. A little more than 40 years later, medical researcher Henry Dale studied the pharmacological effects of nicotine and muscarine and went on to publish the concept of nicotinic and muscarinic parasympathetic nervous systems based on the effects that he observed. And this is where these receptors get their namesake. 20 years later, he and Otto Louis discovered acetylcholine, which is the endogenous muscarinic and nicotinic ligand, and they eventually went on to share the Nobel Prize for their work. Acetylcholine is a ubiquitous, important messenger in the body, and it has a wide variety of functions. Muscarinic receptors control pupil contractions in the eye, and acetylcholine is used as an eye drop to constrict the pupil during cataract surgery. It is also responsible for lowering heart rate and blood pressure. Anticholinergics, like atropine, are used to counteract acetylcholine, which is why in media and hospital dramas, the doctors will use atropine to rescue their patients in cardiac arrest. Now, muscarine was once thought to be the hallucinogenic compound in these mushrooms, but because of its negligible concentration, that hypothesis was abandoned. The search for the psychedelic alkaloids of Amanita muscaria culminated in several groups simultaneously publishing the isolation and characterization of ibotenic acid, mucimol, muscazone, and muscazole between 1964 and 1965. They also demonstrated that ibotenic acid and mucimol were responsible for the hallucinogenic properties of this mushroom. In 1977, Paul Gogsgaard Larsen synthesized gaboxidol as an analgesic and an anti-anxiety medication, and the structure was based on mucimol. Alkaloids aren't the only toxins found in mushrooms, and in 1986, the vanadium complex amavadin was isolated from Amanita muscaria, showing its potential for heavy metal absorption. Muscaria has been explored as a pharmaceutical for neurological disorders, and it has been done in very small clinical trials. One study for Parkinson's treatment was withdrawn in 2017, and another for drug-resistant epilepsy was published in 2019. While there has been significant research into these alkaloids, the biosynthetic pathway has yet to be proven, and a presumptive pathway was most recently published in 2020. Amanita muscaria alkaloids are derived from the amino acid glutamate. Glutamate is hydroxylated by IboH to form 3-hydroxyglutamate, which can then undergo two different pathways. Either it can undergo amination to 3-hydroxyglutamine by IboA, then oxidation by IboF to 3-hydroxyglutamine hydroxamate, followed by cyclization and elimination by IboG to form tricolomic acid. Or it can undergo a second pathway with an unidentified hypothetical external amine through IboG and IboA directly from 3-hydroxyglutamate. Tricolomic acid is aromatized by IboC to form ibotenic acid, which appears to be the stable form of these isoxazoles in the mushroom body. This can then be rearranged in the presence of light to form muscazone, or it can decarboxylate to mucimol by either IboD in the mushroom body, exposure to heat, or through metabolism when the mushroom is consumed. Ibotenic acid is also thought to be neurotoxic, which is why many preparations involve drying the mushrooms, making them into a tea, and simmering the caps by boiling water for 15 to 30 minutes, which converts the ibotenic acid into mucimol. Ibotenic acid is also more prevalent in Amanita muscaria than it is in Amanita pantherina. It is an agonist on glutamate receptors in the central nervous system, and the structure is similar to glutamic acid, hence where it's derived from, though it is a more rigid structure due to the isoxazole ring. This agonism causes an excited state with symptoms of confusion, agitation, delirium, and euphoria. You can see that the structures have a nice overlay. Oral doses that elicit this excitatory response are typically about 30 to 60 milligrams, and they're taken by mouth. Now, glutamate receptors work in concert with GABA receptors in the brain. Glutamate is the gas pedal in neuronal signaling, while GABA is more of the brakes. Mucimol is a potent GABA receptor agonist and is more prevalent in Amanita pantherina than it is in Amanita muscaria. The structure of mucimol has a similar features to GABA, and then you can see that there's a nice little overlay there with the two structures as well. GABA-A agonists increase the concentration of GABA, which lowers heart rate and blood pressure, and it causes a sedative effect. This is also the receptor that barbiturates and benzodiazepines target. Smaller doses of mucimol have been said to resemble the effects of diazepam, and a typical dose is around 6 milligrams by mouth. Toxic doses, though, cause a syndrome called pantherina muscaria syndrome, and this causes dry mouth, pupil dilation, loss of muscle coordination, dizziness, confusion, sedation, and sometimes euphoria. GABA receptor agonists and partial agonists are often used to treat anxiety and can be used as sedatives and depressants. Mucimol is being investigated for conditions that cause epilepsy. The clinical trial I mentioned earlier from 2019 utilized mucimol for drug-resistant epilepsy in 3 people between the years 2005 and 2018. Only one of the 3 patients experienced fewer seizures. The investigators reported that the drug was safe enough to warrant further research, but there wasn't enough evidence to support the efficacy of mucimol at this time. While mucimol is an agonist of GABA, introducing rigidity into the structure in the case of gaboxidol increases the potency, and it makes it GABA alpha superagonist, or GABA-A superagonist. Merck and Lundbeck conducted clinical trials from 2003 to 2007 to treat insomnia. However, this drug was abandoned due to safety concerns and lack of efficacy. But Ovid Therapeutics conducted a phase 2 trial for the genetic condition Engelmann syndrome, which can cause developmental delays in epilepsy, and they also reported that more study is required. While GABA, glutamate, and muscarinic receptor activity can elicit euphoria and hallucinations, the prevailing hypothesis suggests that a different set of receptors is responsible for traditional psychedelic effects that we so often see portrayed in the media. The next two fungi have similar pharmacology to that end. And we'll begin with Claviceps purpurea and the lysergic acid amides. Species from the genus Claviceps are some of the most notorious fungi in the world and are commonly referred to as ergot. The most well-known is Claviceps purpurea. Ergot is an infectious fungus that occurs in the flower of wild and cultivated grasses, most notably rye. Claviceps hails from the Asomycota or sac-like division of the fungi kingdom. Think organisms like yeasts and penicillin. The fungi spores act like pollen and infect the flower of the grass, replacing the seed and hijacking the nutrition supply. The spores grow into a dark body called the sclerotium. You can see that here emitting from the wheat flower. And the sclerotium is robust enough to survive harsh winters, and it also thrives in cold, wet conditions. Claviceps are found mainly in temperate regions, but because of this resilience, they can also be found in subtropical and Arctic habitats. There are over 50 species of Claviceps worldwide. The active alkaloids found in the sclerotium contain the ergoline scaffold. This scaffold contains an indole, a cyclohexyl group, and a piperidine group connected in this manner. And that will come into play and become very important in its pharmacology later. These alkaloids can make up as much as 2% of the dry body weight of the sclerotium. All ergot alkaloids derive from the natural amino acid tryptophan, and this is where the indole structure is introduced. If you look at this little guy right here, this is your indole structure. And tryptophan undergoes several transformations to form chanooclavin 1, and that's where we install the cyclohexyl ring. Chanooclavin 1 is oxidized to form the aldehyde, which is then cyclized to form agroclavine, and that installs the piperidine ring located here. So we have indole, cyclohexyl group, and piperidine ring. And that is then oxidized by cytochrome P450 to lysergic acid. And lysergic acid may then be conjugated to a simple amino acid like L-alanol to form ergonovine, which is also known as ergometrine. Put that in your cap for later. Or it can be conjugated to a chain of amino acids to form ergopeptides like ergotamine. Ergot alkaloids are broken down into 3 different classes. There are tricyclic and tetracyclic alkaloids called clavines. And these fall into 3 subcategories. There are those that are rearranged. They're missing the combination of the indole, the cyclohexyl group, and the piperidinal ring. They have 1 or 2 of those features, but they don't have all 3. And then there are the secoergolines, which have the indole, the cyclohexyl group, but the piperidinal group is in an open conformation. And then we have the ergolines, which have all of those features that we described, but what makes them a little bit different than the others is that this group here, which is 2 carbons away from the nitrogen on the piperidine ring, contains an alkyl or hydroxy group, and that becomes important to their pharmacology, which we'll discuss a little bit later. The second class of compounds is composed of the ergoamides, or the lysergic acid amides. And then there is the ergopeptides, which have all of those structures. The things that make these unique and different than any of the other ergolines is that they have a carboxylic acid group or an amide group. So we see the amide group here on the ergopeptides, amide group on the ergoamides, and then the lysergic acid has a carboxylic acid. And again, that becomes important to their pharmacology. So these alkaloids do have some pharmacological activity when it comes to psychedelics, particularly the ergoamides and the ergopeptides, but all of them are vasoconstrictors, and that means that they constrict blood vessels, and ingestion can lead to a condition called ergotism. Ergotism has two clinical presentations. There's the convulsive, which is characterized by fever, hallucinations, convulsions, and erratic behavior. The second is a more extreme presentation, and it's the gangrenous form. Gangrene is a restriction of blood flow to the extremities, which leads to death of tissues. It is a gruesome condition, and it's claimed the lives of many. And this is frequently accompanied by an excruciating burning sensation, which is why ergotism received the Latin moniker ignis sacer, or holy fire. In 2021, a mild case of ergotism was presented in Canada. The patient experienced loss of feeling and coldness in their left hand. Here we see the right hand has typical coloration and the vasculature is robust. You can clearly see the blood vessels, while in the left hand, where the symptoms were experienced, is much paler, and all those blood vessels are constricted to the point where you might not even be able to see some of them. Now, the patient was treated with prostaglandins, nitroglycerin, and anticoagulants to dilate the vessels and prevent clotting, which is one of the biggest dangers. The patient was back to normal after 6 days and discharged without further incident thanks to modern medicine. Victims in the past, however, were not so lucky. Ergotism claimed the victims frequently enough in France that a religious order was formed to care for them in 1092. The order chose St. Anthony the Great as their patron saint to honor his struggles in the desert, which has been captured in Salvador Dali's painting titled The Temptation of St. Anthony. He is also the patron saint of infectious diseases and skin conditions, and because of this, ergotism was often referred to as St. Anthony's fire. There's also speculation that other skin conditions fall under this term of St. Anthony's fire, and those conditions include herpes zoster and plague. Multiple infections have occurred throughout history, but it wasn't until 1667 that ergot infected rye was identified as the cause of the condition. Now, ergotism is rarely seen today due to modern food safety measures, but it's still a threat to livestock. And while ergot has a tumultuous history as a toxin, active compounds that have been extracted from the fungi do have value in modern medicine. When ergot is taken as a whole, there are lots of alkaloids and other natural components that work in chaotic concert. However, when a single compound is isolated and dosed appropriately, it can bring relief to painful conditions like migraine. The ergoline structure of these alkaloids makes the pharmacology behind them incredibly complicated. The ergoline scaffold has the capacity to bind to serotonin, dopamine, and adrenergic receptors. If we look at the endogenous ligands to these receptors, we can imagine that serotonin can fold into that ergoline structure, as well as dopamine and noradrenaline, which is the endogenous ligand to adrenergic receptors. Several current and historical pharmaceuticals utilize serotonin and adrenergic receptor targeting to stimulate smooth muscle contraction and constrict blood vessels. And these pharmaceuticals utilize these properties to prevent postpartum hemorrhage, which is bleeding that occurs after childbirth. There are also the receptors that are targeted to treat migraine headaches. Other pharmaceuticals target dopamine receptors to treat Parkinson's disease, a neurological disorder that arises from the lack of dopamine. Now, while these drugs do have benefit, Paracelsus taught us that the dose makes the poison, and long-term and excessive use of some of these pharmaceuticals have caused negative side effects in the past. Overuse is the leading cause of the majority of modern-day cases of ergotism. The patient that I had described earlier had been prescribed ergotamine tartrate for a headache, and this is normally a temporary and harmless drug, but the medication had interacted with the patient's daily medications, which caused the vasoconstriction in the patient's left hand. Pharmacology and drug discovery is a very complicated process, and we are still learning, which is why we say practicing medicine. Here are a few examples of semisynthetic ergot pharmaceuticals that utilize that ergoline core. Carbergoline is used to suppress lactation, treat uterine fibroids, and Parkinson's disease. Ergoline is used for vascular disorders and dementia. Methyl ergometrine, which I told you to put a little cap and a feather in your cap earlier with that biosynthetic pathway. This is a analog of ergometrine or ergonovine. The difference is that there's an additional little methyl tether here, making this an ethyl group instead of a methyl group. And that drug is used to treat postpartum hemorrhage and migraine. Pergolide was used to treat Parkinson's disease, but was pulled from the U.S. market because of the link to valvular heart disease. It's still used as a veterinary medicine under the brand name Prasend. Bromocriptine, which has a unique structure similar to the ergotamine, it is an ergopeptide. It has a bromine here at this 2 position, which we will talk about a little bit later, another feather to put in your cap. This is used to treat Parkinson's, type 2 diabetes, and it suppresses the hormones that cause acromegaly and hyperprolactinemia. Acromegaly is a condition that causes the body to produce too much growth hormone. This causes the individuals with this disorder to grow very large. The wrestler and actor Andre the Giant and French wrestler Maurice Tillet, the inspiration for the character Shrek, had genetic conditions that caused their acromegaly, while a pituitary tumor caused the hormone imbalance in Tony Robbins. While many of our pharmaceuticals are derived from ergot, ergot as a whole is one of the oldest recorded natural pharmaceuticals and psychedelics. Records date back as far as 1900 BCE in Mesopotamia, where infested grain was described as Meru and Simona. And the Chinese philosopher and physician Chu Cheng described the use of ergot in obstetrics as far back as 1100 BCE. Hippocrates, the father of medicine, described the use of ergot for postpartum hemorrhage in 370 BCE, and at that time it was referred to as melantheion. Ergotism would go on to claim many lives, but it claimed 20,000 people in France between the years 944 and 945, which was a prelude to the formation of the Order of St. Anthony in 1092. In the 1500s, German physician and botanist Adam Loenisser observed and recorded midwives using a preparation of ergot, and that was referred to as pulvis ad partum, and that was used to induce uterine contractions to facilitate childbirth. While this was effective in some cases, it often resulted in uterine rupture, which would kill the patient, and that led to it being renamed pulvis ad mortem. Its use was eventually discontinued for anything other than the prevention of postpartum hemorrhaging. And as we discussed earlier, ergot can cause hallucinations, convulsions, and erratic behavior, which is why many suspect ergot poisoning was a contributing factor in the Salem witch trials of 1692. In 1820, ergot was introduced to the first edition of the United States Pharmacopoeia as a therapeutic to prevent postpartum hemorrhage. And ergotamine tartrate was patented by Arthur Stoll in 1918, which kicked off the industrial production of ergot alkaloids as pharmaceuticals. In 1935, ergonovine was introduced as a therapeutic, and its analog, methyl ergometrine, is still used today, as we discussed earlier. 3 years later, 1938, Albert Hofmann, the man, the myth, the legend, synthesizes the world's most notorious psychedelic, LSD, from ergot alkaloids in his lab at Sandoz. LSD is a big drug in pop culture. It has many names and it evokes vivid images of hallucinogenic episodes, which are colloquially called acid trips. Users often describe changes in perception, such as hearing colors and seeing music. Many people report having an intense emotional and mystical experience. They experience heightened perception and awareness and have the feeling of a loss of the ego. Higher doses or inappropriate settings can trigger bad trips, where the experience shifts from pleasant to confusion, anxiety, and depressive mental states. One of the more iconic pop culture references includes Fear and Loathing in Las Vegas, where Hunter S. Thompson, portrayed by Johnny Depp in the movie, recalls using LSD, among many other drugs, in San Francisco in the mid-1960s, and psychonaut icons Alexander and Anne Shulgin published the synthesis and a trip report of LSD in their book TiHKAL, Tryptamines I Have Known and Loved. In the last few years, Netflix has released a couple of documentaries on psychedelics, one based on Michael Pollan's book titled Change Your Mind, which discusses the research and attitudes regarding psychedelics and LSD, and the other is Have a Good Trip, Adventures in Psychedelics, which is a set of quite comedic celebrity interviews where they relay their experiences with LSD and other psychedelics like psilocybe mushrooms. While the recreational side of LSD is widely recognized, the science behind its potential as a therapeutic is still developing. And it all began in 1933 when Albert Hofmann began researching the chemistry and pharmacology of ergot alkaloids at Sandoz Pharmaceutical Company. In the search for an analeptic, he hydrolyzed ergotamine, the natural product, to lysergic acid through base hydrolysis, and then would perform various aminations with different amines. In this case, he used diethylamine to form LSD. He was changing the amine structure on ergonavine to test the analytic properties and how they changed when the amide group was changed as well. And he called the compound LSD-25 because it was the 25th compound in the series that he was working on. But because the compounds he was working on were inferior to ergonavine for the purposes they were studying, the project was dropped. And another 5 years would pass until he was inspired to research the compound once more, and while working with it, he accidentally absorbed some LSD on his skin. And he recalls he felt a remarkable but not unpleasant state of intoxication. It was characterized by an intense stimulation of the imagination and an altered state of awareness of the world. 3 days later, he dosed himself intentionally with 250 micrograms and rode his bicycle home with his assistant, tripping the whole way. And henceforth, April 19th has been dubbed Bicycle Day. You can go to Google and check it out. It's kind of cool. Through his experience, he realized the potential LSD had for researching the mind, and Sandoz marketed the compound under the name Delicid, distributing it to researchers and clinicians free of charge, provided they shared their findings. And in the 1950s, the CIA seized upon the mind-bending properties of LSD in the MK Ultra initiative, where they were searching for and testing multiple substances to discover an agent for mind control. LSD soon became the poster child of the 1960s counterculture. The pharmacology of traditional psychedelics is still being researched today, heavily. However, it is primarily linked with serotonin receptors. Serotonin is a tryptamine neurotransmitter, which means it has a tryptamine backbone. And then at the 5 position, there's a hydroxy group, and that is why it's called 5-HT or 5-hydroxytryptamine. And it is responsible for modulating mood, cognition, memory, and learning reward behaviors. It's also known as the happy molecule. And the serotonin receptor family is comprised of 14 total receptors. 13 are G-coupled protein receptors, 5-HT, 1, 2, and 4 through 7, and one ligand gated ion channel, and that is 5-HT3. Now, we still don't have a clear picture of how receptor binding affects clinical presentation of these compounds, but the prevailing wisdom states that the activation of the 5-HT2A receptor is essential for the psychedelic experience in humans. The 5-HT2A receptor is found in many areas of the brain that deal with higher processing, and the receptor was crystallized with LSD in the binding pocket in 2020. And it looks like the residues D155, W336, and S242 are important for tryptamine binding in the receptor pocket. Now, these conclusions about how receptor binding works are typically corroborated in mice with the head twitch response, and that when a mouse has a head twitch response, that typically indicates that the compound will have psychedelic activity in humans. A paper came out in October 2023 showing that the 5-hydroxytryptamine 2C receptor can also contribute to the head twitch response in addition to the 2A. So pharmacology is complicated, and the receptor binding doesn't necessarily translate to clinical presentation every time. Research is ongoing, and there's an effort to figure out if the therapeutic response is actually tied to the psychedelic presentation or if it can be decoupled by targeting different receptors. So is the psychedelic presentation part of the therapy, or is it a byproduct? And these are the questions that are being asked by clinicians all over the world. But regardless of whether or not we see clinical presentation, targeting the correct receptors is important because agonists at 5-HT2B have been implicated in negative cardiac events. So we're still constantly learning, and we may not have all the answers, but we can draw some conclusions from the data and observations that we've already acquired. While the exact mechanism of LSD remains unclear, receptor binding studies show that it has mixed agonism at serotonin, dopamine, and adrenergic receptors because of its ergot core. When we look at binding constants, keep in mind that the lower the Ki, the stronger the affinity for that receptor, which means that it binds more strongly at lower doses. And LSD has nanomolar affinity at most of these receptors, making it very potent and indiscriminate. In humans, the affinity for the 5-HT2A receptor is very strong at 2.7 nanomolar. And this is why sub-milligram doses are typical. LSD is taken orally, and the effects can last up to 10 hours. The half-life of LSD is approximately 175 minutes, which means it takes almost 3 hours to metabolize half the dose taken. The psychedelic properties of LSD depend on the location of the substituents, their spatial position, and the degrees of saturation on the ergot core. And there are two types of numbering for the position of LSD. There is the IUPAC numbering, which if you use software like ChemDraw, this is the numbering that will come up. However, it's not the numbering that is typically used when discussing LSD and their substituents. The typical notation is the Hoffman notation, which we will use for the rest of this discussion. Psychedelic activity is diminished when any of the following happens. If the bonds between 9 and 10 are saturated, that double bond goes away. If the stereochemistry is inverted at positions 8 and 5, if we would look at this structure, if it was in 3D, the wedges mean that they're facing out toward you. If the wedges face away from you, that's the stereo inversion. And then if we look at the amide, the diethylamine appears to be the optimal size for the amide position. Increasing or decreasing that chain length will decrease the activity. And if there's a substitution at the 2 position, then the compound is basically rendered inactive. Remember bromocryptine, which I told you to put another feather in your cap, that could be used to treat acromegaly. It had a bromine here at the 2 position, which means that it's not terribly psychoactive. Probably not as psychoactive at all. Because LSD has this unique pharmacology, several clinical trials have already been completed with LSD as the treatment candidate. There are currently 7 trials in progress and 3 more that are not yet recruiting, which you can find more information on at clinicaltrials.gov. These trials are using LSD as a tool to investigate major depressive disorder, mood effects and anxiety, palliative care, neuroplasticity, cluster headaches, the pharmacological effects of co-administration of LSD with other medications, among many others. One small phase 2 clinical trial from the University of Basel in Switzerland found that acute positive experiences with LSD correlated with long-term reduction in anxiety symptoms. However, there were also some people who experienced negative side effects, so more study is needed, but the results show promise for the future. And that brings us to our third fungi, those species from the genus Psilocybe. Psilocybe mushrooms fall under the Basidiomycota division of the fungi kingdom, under the order of Agaricales, similar to Amanita muscaria. They are also mushrooms that aid in decomposition of organic matter. And unlike Amanita muscaria, these mushrooms produce tryptamine alkaloids with similar pharmacology to Claviceps. The most prevalent alkaloid is Psilocybin, and that has a tryptamine core. You can see that the tryptamine overlays. But at the 4 position of psilocybin, there is an oxygen group tethered to a phosphate group. And that's what makes it kind of unique. There are also other genus and species of psilocybin producing mushrooms. However, there are over 150 species of Psilocybe worldwide. These mushrooms are typically small, brown to white mushrooms that have a distinct characteristic blue tint when they're damaged, and their habitats are the tropics and subtropics, and they thrive in soil, dung, wood, and mosses. While psilocybin mushrooms exist worldwide, they are heavily concentrated in Mexico and Central America. Religious practices are thought to have involved these mushrooms since at least 2000 BCE. One of the earliest records is a Tepantitla mural in Teotihuacan from the year 500 depicting the Toltec rain god bearing these mushrooms in his hands. The Aztecs called the mushroom Teonanacatl, and their use was recorded in the 1500s by the monk Bernardino de Sahagún in his book Historia General de las Cosas de la Nueva España. These mushrooms remained a myth and a mystery until 1936 when the ethnologist Robert Whiteliner obtained specimens and sent them to Harvard. Prior to this, the existence and the use of these mushrooms was a closely guarded secret. Unfortunately for Whiteliner, the samples degraded before they could be studied. However, 2 years later, Harvard botanist Richard Evan Schultes was also able to obtain specimens of Psilocybe cerulescens in Oaxaca, Mexico, but studies were dropped with the onset of World War II, and almost 20 years would pass before they came back into focus when R. Gordon Wasson, an amateur mycologist, read about Schultes' discovery of the fabled mushrooms and set out with his colleague Alan Richardson to a small village in Oaxaca to participate in a Mazatec ritual employing the Psilocybe mushrooms. The ritual was conducted by Maria Sabina, she is pictured, under the agreement that the process would be held in the strictest confidence, never to be revealed. He agreed, but 2 years later, he went on to publish a photo essay detailing the ritual and his psychedelic experience in Life magazine, bringing the mushroom to Western awareness. And as a consequence, many Westerners flocked to her village in search of the mushrooms. This revelation ultimately led to tragedy for Maria Sabina and her family. Samples of Psilocybe mexicana were sent to Albert Hoffman, our LSD connoisseur at Sandoz, and he and his colleague R. Heim were able to isolate the active alkaloid psilocybin. In order to confirm the structural identity, they also conducted a full-scale synthesis the next year. Psilocybin, LSD, and mescaline are reported to have similar psychedelic effects when compared by Wolbach in 1962, and research into these substances proliferated. However, it was brought to wider attention when Harvard psychologist Timothy Leary was expelled for questionable ethics and promoting drug use on campus. He went on to become one of the loudest proponents for psychedelics in counterculture and was labeled the most dangerous man in America by President Richard Nixon. The culture war of the 60s ushered in negative public sentiment towards psychedelics, and in response, the United States passed the Controlled Substances Act, with the UN passing the Convention of Psychotropic Substances in 1971. This international prohibition throttled research into psychedelics, bringing it to a trickle. However, attitudes have softened over time, and small pockets of research began dusting off and exploring these old tools. Johns Hopkins published a landmark study on the safety and efficacy of psilocybin in 2006, which sparked a renewal of psychedelic research worldwide. While psilocybin is the most prevalent alkaloid in psilocybe mushrooms, it is not the only alkaloid of interest. The biosynthesis of tryptamine alkaloids again comes from the amino acid tryptophan, where we see that indole coming in again. And this is decarboxylated by tryptophan decarboxylase to form tryptamine. And that is then oxidized to 4-hydroxytryptamine by a monooxygenase. And 4-hydroxytryptamine is then phosphorylated by a kinase to form norvacystine. It can then undergo methylations by N-methyltransferase to form baeocystin. It can undergo a second methylation to form psilocybin, and a third to form aruginacin. Aruginacin has been implicated in a phenomenon known as wood lover's paralysis, which happens to be reported in Australia, and I think there's some anecdotal evidence that it's shown up as well in Portland, Oregon. Consumption of the mushrooms that grow near wooded areas appears to cause a temporary paralysis in users, and it's linked with specific species of Azurensis, Cyanensis, and Subaruginacea. The hypothesis is that aruginacin has a similar structure to bufotenine, which is a paralytic agent found in toad venom. However, this has not been confirmed, and it may be attributed to a completely unknown compound, not even a tryptamine. More research is required. When mushrooms are damaged, they rapidly dephosphorylate psilocybin to psilocin. And when psilocin is exposed to light, oxygen, or the enzyme lacase, it is then converted to oligomers that cause the characteristic bluing that the mushroom is known for. And this process is hypothesized to be a pest deterrent, as the mushroom does have the capacity to rephosphorylate psilocin back to psilocybin. So when the attack is over, the mushroom can repair itself, supposedly. Psilocin is thought to be primarily a degradation product, but there is a shunt pathway from 4-hydroxytryptamine to norpsilocin, which could mean that psilocin is an intermediate, but at this time there's no real evidence that it is an intermediate so much as a degradation product. There are other alkaloids that can also be found in the psilocybin mushrooms, including the beta-carbolines. These are also found in other natural medicinal plants preparations such as harmala and ayahuasca, and they have this structure with an indole and a piperidine backpack. And carboline itself would have a nitrogen located here at the alpha position, but these are beta-carbolines, which means that the nitrogen moves to the beta position. And in psilocybin mushrooms, the substituents are located here at the alpha position typically. Harmine and harmane do have some slight activity at the serotonin 5-HT2A receptor. However, most of these beta-carbolines act as MAOA inhibitors, which means they inhibit monoamine oxidase A. Monoamine oxidase A is one of the main enzymes that breaks down tryptamines in the body, which means that in the presence of beta-carbolines, the tryptamine alkaloids in psilocybe will typically circulate longer in the body, which extends the experience. A structure-activity study comparing psilocybin to psilocin demonstrated that psilocybin itself has no affinity at the 5-HT2A receptor, but once it's dephosphorylated by first-pass metabolism, it forms psilocin, which does have affinity for that 5-HT2A, which allows the psilocin to cross the blood-brain barrier and exert its effects on the brain. Psilocin is then broken down by monoamine oxidase and aldehyde dehydrogenases to form water-soluble metabolites, 4-hydroxyindole 3-acetic acid and 4-hydroxytryptophan. And that means that they're easier to be excreted out of the body, making them more water-soluble. Second-pass metabolism, if they stick around long enough, forms the glucuronide. And as a prodrug of psilocin, the clinical dose of psilocybin is anywhere from 2 to 20 mg by mouth. And the effects can last from 3 to 6 hours, which is a much shorter duration than the 5 to 10 hour experience of LSD. So let's compare psilocin, the active ingredient in psilocybe, to LSD. Remember, LSD has strong binding at multiple receptors, the dopamine, adrenergic, and serotonin receptors. The smaller the Ki, the stronger the affinity at those receptors, and these are nanomolar. So that means that it takes a very small amount to elicit a response. And if we look at psilocin, these numbers are a little bit larger. They're still a nanomolar, but they're not as potent at these receptors. And when you have values that are greater than 10,000, that essentially means that this compound isn't active at that receptor. So psilocin has less affinity at these receptors, and it also is less potent at the 5-HT2A receptor. Remember that it takes 2.7 nanomolar of LSD to elicit effect at 5-HT2A. Well, it takes about 25 or 107, depending on the source you're looking at, nanomolar to exert a psychedelic effect. And because of this, psilocin and psilocybin have a lower risk profile as a pharmaceutical. What's really cool about psilocin and psilocybin is that neural imaging studies have shown that psilocybin administration can interrupt the brain's default mode network, which controls the majority of our neural processing. It's responsible for the executive functioning that happens in the background while we're doing our day-to-day activities until we focus on a task or an external stimuli, which will shut that down, and then we do go about our activities. But it's kind of like the quiet processing that happens in the background. And psilocybin appears to disrupt this network, which causes different parts of the brain to make new connections that otherwise wouldn't. It's kind of like a super highway getting blocked, and then everyone getting off on the off ramps and going on a day trip and checking out towns they wouldn't otherwise have ever discovered. LSD functions in a similar manner, and this ability to rewire the brain is what makes these two molecules so attractive. In the 1950s, Sandoz marketed psilocybin as a short-acting alternative to LSD. However, it was pulled from the market due to the Controlled Substances Act and negative attitudes towards psychedelics. But as we discussed earlier, attitudes have changed, and psilocin and psilocybin are once again gaining popularity as a potential therapeutic. As of October 2023, there are multiple clinical trials recruiting and in progress employing psilocybin as a tool and a treatment for many disorders, including but not limited to PTSD, major depressive disorder, bipolar, anxiety, anorexia, various substance use disorders, Fragile X syndrome, chronic pain, OCD, phantom limb pain, and frontline worker burnout. They're also looking at the pharmacological effects of microdosing and asking how psilocybin affects thoughts, perception, and social behaviors. There are also studies exploring that serotonin receptor to try and figure out how these things work better. And they're also comparing the effects of psilocybin to psilocin. While the number of trials has rapidly increased, there are still significant barriers to conducting these trials, mostly due to regulatory status of these compounds. Institutions conducting the trials must have the correct DEA licensing and acquire their materials from providers who are also appropriately licensed. Once the appropriate forms have been filled out, there's a time clock on when the materials have to be sent and received. If there are any inconsistencies on those forms, they have to be resubmitted, and there are quotas on how many forms that can be given out at any one time to any one institution. They also have to be able to find GMP grade APIs, which makes the number of suppliers even fewer who have that licensing and that capacity. Now, a few states have legalized psilocybin mushrooms, and some municipalities have decriminalized them. In Ann Arbor and Washtenaw County, where we are located, they have decriminalized mushrooms, which means that they won't prosecute for possessing them. It doesn't make them legal. But until there's a change in federal law, this will continue to be an obstacle to research. And despite these challenges, psychedelic research is booming. Multiple academic groups and research centers are launching across the country. Biotech companies all over the world are racing to find the next generation of therapeutics, whether it have psychedelic properties or have a decoupled effect. And it all had humble beginnings in nature, in the ground beneath your feet, with the mind-bending magical mushroom. I'd like to thank my colleagues at Cayman Chemical and send them a shout out for all their feedback and their expertise. I do work with a wonderful group of talented scientists and professionals who are always striving to help make research possible. We also recently published our poster on the chemistry of psilocybin mushrooms, so you can use the QR code or follow the link below the poster to request your own copy. We also released an educational tool that discusses the naming and the analysis of LSD. And if you have any questions, don't hesitate to contact me at dstgermaine@caymanchem.com or contact our tech support at techserve@caymanchem.com. We'd be happy to help you with any requests that you might have and interest that you have in psychedelics and the possible acquisition of reference standards, or API chemicals, please ask me your questions. And thank you so much for attending.
Well, thank you very much for that very insightful presentation. I'd like to invite our audience to continue to send their questions or comments right now using the questions window for this Q&A portion of our webinar. Now, I've already received some questions from the audience for you here, so we'll get ourselves started with those. I have a question here. Very first one from the audience is wondering, are there any advantages to psychedelic medicines not offered by more traditional or conventional therapies? Sorry, Danielle, I think we still have, perhaps I have you on mute. There we are.
Yes, technology. That is the question right now that everyone's trying to look for. One of the attractive features of psychedelics really is the possibility of needing 1 or 2 doses of drug and then doing a cognitive therapy maintenance versus taking pill every day. Usually with antidepressants, you have to take them every day for at least 2 or 3 weeks for the effect to really build up. And it's more of a long-term, or it's more conducive to the long term. And then your challenge really becomes patient compliance. Whereas with therapies like ketamine, that can be tailored for emergency interventions, and the drug works right away in crisis situations with the right support and setting. If you are interested in knowing where this space is headed, I definitely recommend checking out podcasts Psychedelics Today and the Drug Science podcast with David Nutt. They interview researchers and clinicians in the field, and they take a deep dive into a lot of those questions. It's pretty good resource out there.
Great, wonderful. Thank you so much for that answer. The next question is curious if you can give any starting points for pharma companies wishing to pursue these therapies. Specifically, what sort of synthetic and legal considerations are there? Are there any synthetic challenges with LSD or psilocybin analogs?
There's definitely challenges with the synthesis of these analogs. So LSD analogs are going to be more challenging. They are light sensitive. They're harder to produce on scale because you do have to extract them from ergopeptides like ergotamine. I think one of the major ways that they get those now is through fermentation science. Tryptamine analogs are going to be a lot simpler, much lower hanging fruit because they're easy to modify in terms of the synthesis, and the Shulgins synthesized a lot of those psilocin analogs and TCAL tryptamines I have known and loved. So there's quite a few biotech companies looking at amide and aromatic substitutions for modifications of novel IP. In terms of regulatory challenges, I think we discussed those in the podcast, or not podcast, webinar. There's a whole bunch of regulatory hurdles that have to be overcome for them. So starting points is, like, I'd say read TCAL and get started from there.
That's great. Thank you very much. I'm sure they appreciate that. The next question is wondering, is the glutamate receptor agonism for ibotenic acid part of the neurotoxic effects that you mentioned? Do these occur in the 30 to 60 milligram dosage range, or is that a dosage range for the traditionally converted material to mucimol?
I think that dose range is for the excitability symptoms that are clinically presented. What I didn't mention about ibotenic acid and its toxicity is that it has been shown to cause brain lesions in subjects like mice, I think monkeys and rats, when they injected it directly into the brain. And that's one of the scarier parts about this drug, is that if you take it, you may not have any clinical presentations of the toxicity until long after the drug is over, because you're building lesions in your brain and you may not even recognize that happening. So that's one thing I did not get to mention earlier.
Very good. Thank you for covering that then. And really thank you for all of the answers, but we have reached the end of the Q&A portion for this webinar. Now, if we couldn't attend to your questions, know that the team at Cayman Chemical may follow up with you, or if you have further questions, you can direct them to the email address that's up on your screen. I want to thank everyone for participating in today's webinar. You will be receiving a follow-up email from Xtalks with access to the recorded archive for this event. A survey window will be popping up on your screen as you exit, and your participation is appreciated as it helps us to improve our webinars. Additionally, there is a link to view the recording of this event, which you can also share with your colleagues so they may register for the recording here as well. Now, please join me once more in thanking our speaker for her wonderful time here today. We hope that you found the webinar informative. Have a great day, everyone, and thank you for coming.
Thanks for coming.